This is Dr. Salem, Doctor of Physical Therapy from Brooklyn, New York. Today I want to show you a case live from my clinic, a knee pain case. Came in today, look here. Okay, what I want to talk about here now, I want to talk about the proper joint alignment, the proper alignment between the tibial condyles and the femoral ones, okay? You need to get this alignment in static first. If they properly align aesthetically, then you're going to get, good alignment and movement. Going to be movement with no pain. I fixed it a little bit. The camera didn't work in the beginning. What was having here before? If you look here, guys, we need to build up skill for inspection. Doesn't come overnight. You need to keep training, put in your head. You need to build up inspection skills. You need to build up palpatory skills. You need to open your mind, guys. Please don't be stuck with the old ideas, okay? Don't be stuck. I want you to keep learning. That's why I'm saying this, guys, now. I'm, long time in the job, and we need to pass this for the younger generation, okay? Do not block your mind. What I want to say here, guys, the femoral condyles medially, look at here. The medial femoral condyle is more medial than the tibial ones. And the lateral tibial condyle is more lateral, so positional fault. Look at this. If there's a femoral one, so the femoral is more medial and the tibial is lateral. As you see here, look here. Femoral condyle, tibial condyle. Look out here. Okay, the tibial is more lateral. Not only that, if you build up a proper inspection, I fixed it a little bit because the camera didn't work in the beginning. So if you look, the medial aspect of the joint was narrowed and the lateral aspect of the joint line was widened like this. That's why she's having this little bit of bowing legs, little bit of varus. Okay, what I want to tell you now. First, fix the proper joint alignment and static, if you can. That's number one. Number two, fix this bowing of the legs. Bowing of the legs is fixable, 100% fixable. Okay, I would say more like 90% are going to fix it very easily from the first visit. More than 90%. The 5 to 10% going to take longer time and off work. How am I gonna fix this bowing here, guys? Look at me. If people with weaker hand, you can put this. You see my elbow here, and I'm holding here. Now there's a fulcrum here to the lateral tibia. Look at this, and I'm gonna hold here. This movement is not rotational movement. The movement you see, this movement is not rotational. This is fulcrum stable here. Now here, I'm widening the medial joint line. Widening a little bit. I'm stretching the medial collateral ligament. All the contractile and non-contractile soft tissues in the medial aspect are being stretched now. I'm going to do this and this fulcrum in here. Now I'm aligning the joint. I'm aligning the tibial condyles. I'm aligning the joint line. We're narrowing in the medial joint line, medial side of joint line, and then we're widening of the lateral aspect of the joint line. Now I'm normalizing it, fixing it. That's number one. Number two, they were bowing of the leg. They were varus. Now look at this movement here. Look at the leg. This movement happening here is from the joint, but also I can get the movement in the leg as well. See this? This is not rotational movement. This is actually strain. This lateral straining here. I'm doing lateral straining to the tibia itself to realign. Look at the joint now is having bowing. Look at the line now. Now the knees are properly aligned. Put the camera from top down, Alia, please. From the top down. Look now here. The thigh, the femur, and tibia are aligned. Not only that, the tibia itself is aligned. Look here. Look at this movement. Do you see the movement? Do you see this movement here, guys? Okay, this movement here, very light movement. See now, there's no more varus. There's no more bowing. There's no more narrowing in the medial joint line. There is no more widening of the lateral joint line. There is proper alignment of the tibia and femur. I can do this with my hand, as you see here. Look now, it's properly aligned. Okay. Okay. This is direct treatment. What I'm doing now is direct. We can do this in very subtle ways. There is another way you can do this, much less effort, for therapists who are pregnant or not strong or sick, whatever. I'm going to show this in coming videos. Maybe not today, but I'm going to show in coming videos. But you see here now, this joint is aligned. I can do this with my hand as you saw today. We're fixing the bowing. We're fixing the joint alignment. We're fixing the joint line. We are, look at this now. Before, where the tibial condyle was so much laterally displaced, get here, Arya, please. This was, the tibial condyle was actually much laterally displaced from the femoral ones in the beginning. Look here. This was much more displaced laterally, the tibial. And the medial femoral condyle is much more in. Now, this is aligned here, guys, together, aligned in the back here. Now, lateral aspect is aligned. Both tibial condyle and femoral condyle are properly aligned here, and the leg, no more bowing. Okay, no more bowing in the leg, no more varus. Okay, keep subscribe, keep watching. Do not stuck your mind. Learn from your elders, guys. I'm gonna give you an example. I learned it from Sheikh al-Sha'rawi. Why people cook the ملوخية but not the نعناع. Why they don't cook mint? Why do we eat? Why we cook the squash but not the cucumber? Why you eat the cucumber without cooking? Why we cook the squash? We learned it from ancestors. We learned it from our parents and from the people ahead of us. Please keep learning. Do not stuck your mind. Bye-bye. Stay tuned, subscribe, share it with your friends.